Hi, I'm Dr. Sridhar K, consultant neonatologist. Welcome to my channel, and I hope you have subscribed. Please encourage your friends and relatives, colleagues to subscribe as well. One of the common requests that I've had from parents is to make a video on sleep pattern of babies and tips to help with disturbed sleep pattern. So in this video, I'll try to give a brief outline. Obviously, every baby is different and each baby has different patterns from time to time. And there are events like an infection or colic, for example, in the early stages, or teething in the later stages, which may disturb the sleep routine. So the main thing is to be flexible and don't be fixated on getting the baby a certain number of hours of sleep. Newborns do sleep a lot. 16 to 18 hours a day is the expected sleep duration. It starts reducing in the next few months, like infants in the first 6 to 12 months may sleep 14 to 16 hours, and it reduces to 12 to 16 hours after the first year of life. After 2 years, the babies may start sleeping anywhere from 8 to 14 hours. So you cannot dictate, don't count the hours. It varies from day to day. A baby may sleep more on a certain day. There may be periods when the baby sleeps for 6 to 7 hours continuously, and then he keeps feeding repeatedly, cluster feeding as we call it in breastfed babies. So this may happen as well. So factors like where you let the baby sleep, whether the baby is sleeping in a crib or whether the baby is sleeping next to you, may affect it as well. The sleep routine, the bathing routine may affect as well. A good massage followed by a bathing routine, cuddling the baby, playing with the baby, and the way you feed the baby also affects the sleep pattern. So first point is not to be worried about the sleep duration. So don't count the number of hours your baby sleeps. It's quite variable. The next point is about the feed pattern. So I know exclusive breastfeeding babies do not have a definite pattern. However, we teach them sometimes to go to the breast whenever they are slightly disturbed or crying. So the natural breastfeeding support is obviously to feed the baby on demand. How we detect the demand can sometimes be flawed, and we may end up pushing the baby to feed more. Colic is a phase when the baby cries with discomfort after 2 to 3 weeks, and if you start feeding the baby whenever there is a cry, you may end up overfeeding, and overfeeding may lead to reflux. The baby also starts looking for the breast whenever they are slightly disturbed. So a reasonable pattern for the feeding is a good option. So 2 to 5 hours after the first 2 weeks is a reasonable pattern. Of course, don't be too rigid. In a formula feeding baby, it's more easy to pattern, but again, we should support breastfeeding, and exclusive breastfeeding is ideal. So look at ways you can manage the feeding pattern. If a baby has mild reflux, you can try to delay the feeds as best as you can, like 2 to 4 hourly feeds. You can consider using a pacifier. I know exclusive breastfeeding, in the first 3 weeks at least, you don't use a pacifier to avoid nipple confusion. And if the baby is very irritable or the mother has older kids and it's difficult to manage, a pacifier can be considered, and sudden infant death also has been shown to be reduced. So it's better to use a pacifier to delay the feed slightly than to keep feeding frequently. And the delayed feeding may also encourage the baby to take a slightly bigger volume with the feed, and they may start sleeping better. So it's basically training the baby to wait a little more, and the volume of the feed increases, they sleep more. So this is a common thing. If the reflux has started getting worse, sometimes the baby keeps crying because of the reflux related issues. So discuss with the pediatrician in that case as to what the best source is. And most of the time it's a feeding pattern and slight changes in positioning. Don't lie down on the baby and feed, because sometimes baby may reflux, as well as there is a risk of congestion in the ears because of the eustachian tube being small. Please refer to my video on baby position to look at this further. So supine feeding, though naturally some mothers do it, it's not ideal, and sometimes the baby cries because of pain or discomfort in the ear. And I've seen a few babies coming with small white discharge from the eardrum, though it's not infection. Baby has no fever, is otherwise well, and it usually resolves. So it can happen from reflux or lying down and feeding as well. So I told you about the bath routine, and if a baby has significant crying, especially after 4 to 6 months of age when you don't expect colic or reflux, it's a good option to shuffle the meal times. It's a good option to shuffle the bathing times. So evening bath routine suits many babies. So no need to quieten the home too much during the day. Allow the baby to have a disturbed sleep in the day, and the baby will get used to a longer sleep at night. I've often heard parents complain that the baby doesn't let us sleep. But remember that when the baby is born, they don't really have a day-night cycle, and we actually show them the day-night cycle over time. As we have more noise in the day, we interact more with the baby in the day, and there is brightness which doesn't encourage deep sleep. So don't darken the rooms, don't keep it very quiet during the day, don't keep carrying the baby, because carrying and cuddling too much makes the baby enjoy the warmth, and they don't want to be away from you when you put them down to sleep. So it has to be, everything has to be in a balance. And don't overreact. If the baby cries and you try to cuddle the baby in the bed itself and try to put the baby to sleep. So these are some of the tips. Teething times, obviously, if the teeth is erupting and baby is very uncomfortable for 2 or 3 days, they may go off feed a bit. They may be very irritable, and you can give them the teethers. If you see redness on the gums, you can apply a soothing gel, and occasional doses of paracetamol to reduce the pain when the eruption is actually seen. It should not be used on a routine basis. It should be only used for such indications when the baby seems to be in definite pain. You can give 1 or 2 doses to reduce the pain. The dose of the paracetamol will be similar to what is advised to you at the time of the vaccination visits. So soon after a vaccine, for example, baby may be irritable. So such changes will happen. If a baby is getting a mild cold, the nasal congestion may disturb their sleep. You may need to use a nasal spray. Saline sprays can be used comfortably. Nebulizing saline doesn't help in these situations, so just stick with the nasal saline. And feeding pattern, when you start solids, you may not want to give the solid meals very close to bedtime. So you have a bath at 6:30 or so for the baby and give the solid meal around 7. Then you can give milk feeder close to bedtime by 9:30, 10. Having a consistent pattern is good, but it doesn't always work. So some flexibility is important as well. In a breastfeeding baby, as the baby gets older, try to minimize the number of times you breastfeed at night, so the baby naturally starts feeding better. So these are some tips. Obviously, it's not exhaustive. I hope it helps, and don't be anxious. Be flexible. Be thoughtful of what process changes can help the sleep. Work on it, and best wishes. And do subscribe if you have not already subscribed. Do share with your friends and encourage them to subscribe as well. As I've mentioned in my earlier video, it does encourage us to see the numbers increasing, so more people watching gives you more motivation to create more content. I hope this helps. Thank you.